Good morning, everyone. Thank you for being here with us. I'm very glad to introduce you our new concept, our new company in Los Angeles, Media Lab Science. I am Erlandi Jr., responsible for business area and Investiga Group, and I will leave you with Ameann to do the presentation of our new business.
Thank you so much, Erlandi. I am so excited to share our joint venture, and it's been such a pleasure working with your team. And so today we're going to talk about Media Lab Science. And it really is this unique concept where we take our experience in clinical testing and validating beauty brands, and we combine it with our in-studio before and after photos, consumer perception studies, and video testimonials. And it's with this experience that is going to bring you true market success. Many of you know IRSI. IRSI has been around for 43 years, and they are now supported by Allergesia Clinical. And what we've done is we've combined the knowledge and clinical expertise of IRSI and Allergesia to create Media Lab Science with myself and Kelly Hare. Media Lab Science brings to the table video production quality, before and after photos, and with this you can produce amazing social content. So we're going to show you how we do this process and how you can now do a new kind of testing. So together we're going to have the best experience. What we're doing here is we're taking this combination, this dream team of scientists, of clinical testing experts, of production and media and beauty experts, and we're combining it all in one space. And those of you who know the industry know that this does not exist anywhere else, where you're really combining the quality of video production with the knowledge of beauty and clinical testing. So we're based here in Southern California in Studio City. And in our studio, we have the capability of doing the before and after photos, the clinical testing right in-house. And through this, you're going to be able to have the incredible product efficacy claims that you've had in the past in the clinical in-house testing lab. We'll still have expert graders to see the changes in the skin, but we're going to add this consumer perception video. So up close, you can see the changes, and not only see the changes in the skin from the before and after photos, but you're going to hear the changes from the participants and their experience. And this is all shot in our studio. With this, you'll be able to create incredible social and digital media content, because as a brand, you will have access and ownership of all the content that we create during these videos, so that you can slice and dice it and create incredible content, incredible branded content. And the data that we collect is now supported by those same consumer studies and those same experts. So it's all together with the same group of participants. We really do combine this experience of clinical testing, the measurable changes in the skin, video testimonials where participants are sharing their story, their experience, and that's what consumers want to see. They want to see someone like them trying the product, someone like them giving the results and telling about the journey. And you can document the journey. If you do a 30-day or a 60-day study, we can document that journey, not only in the photos, but the video and the story that those participants tell us. The before and after photos are home shopping quality, meaning that the eyes are open. And Lucas and Erlandi and Steve make sure that we have exact precision in replication of all of our before and after photos that are taken. We still continue that consumer perception studies, but it's now combined with the same people that are behind the video, so that you get great consumer testimonials to put on your website, both in verbiage, but also in the way that they're telling the story. This really all starts with recruiting, with Kelly. If you didn't have somebody who is recruiting people that are not only comfortable on camera, because it's LA, right? Most people are comfortable on camera, but because she understands skin and she understands beauty and she understands where the skin needs to start before it needs to get someplace. And one of my most exciting parts is that we can now show these participants the results of their before and afters. And this is done after the study is complete because we don't want to influence them. But then we can capture that on camera. And that is the most exciting part, because sometimes people will cry, sometimes people will laugh, or they'll share a story, but they're really excited to share on camera their testimonials because they can see everything. And it really does start with clinical testing. Lucas has been testing and talking about testing and educating us on all the different types of testing that they do at Allergesia. Are you able to share some more, Lucas?
Of course. So bringing a little bit of the clinical testing perspective to this presentation, I can start telling you that the long road that IRSI and Allergesia went through these 40 years that we've been on the market allows us to work in a very constructive way. So being able to offer you very customized solutions that fit the best to the client product, considering its mechanism of action, the claim needs, the clinical methods, and of course budget issues. But not only in project design, but also in interpreting the results. Our experience adds a huge advantage because this experience helps us to take every last drop of results from the clinical data we can get from the clinical studies. So assembling clinical tests to the media content is such a powerful tool because it can validate what's being captured through the cameras and what the consumers are seeing on the videos. So also it aggregates some interesting numbers to the product communication, to all the advertisement, such as X% of improvement, X% of subjects with improvement, like 98, 99% of improvement, and things like that, that for sure calls the attention of the consumer. Expert grading and self-perceived questionnaire are the basic evaluation of any efficacy clinical study that will generate data that will give the first step in claim support and numbers for communication. Following that, the robustness of the classic biophysical tests that measures parameters as moisturization, transepidermic water loss, color, elasticity, sebum, and among others, will compose the base of our claim support strategy, giving to the reports extra strength in terms of regulatory and juridic assurance. After that, we can aggregate 2D and 3D image analysis tools, and also methods that see deep into the skin, such as ultrasound and confocal microscopy, that will enable to develop a more mechanistic storytelling about the product that will bring even more credibility to the claims and also enhance the visual approach of the communication to a more high-tech perspective. So we hope that all that integrated in the same project can take our client's product communication to the next level.
I'd just like to add something to one of the most brilliant collaborators I've had in quite a long industry, and that is Lucas. And this kind of lends itself because there is every project that we take on, we look at it as a completely unique event. Our only job is to solve problems. And we, as it says here, we provide in-house clinical testing to validate your beauty products, your nutraceuticals. But the most important thing, in my opinion, in all of this is our reputation comes first. Our reputation is critical. We must make sure that everything that we do in the way of clinical testing will enhance the products that you market with the highest quality of work that you both need and you deserve. So that's the basic element of it. Efficacy claims, as I said, are basically problem solving. We sit around, Lucas and I, Erlandi, our team with you, and we come up with a scientific way to support the products. But the consumer today is not someone who just picks up the label, reads the ads, looks at the claims on the box. They demand something more from the industry, from us who are promoting and helping sell the products. And I know for years I worked with Ameann, supporting her, the video work that she was doing, and now have the opportunity to work with her to bring value added to all the work that we do. And again, I repeat that the value added comes at we're acutely aware of costs. And as I said in the beginning, in this situation, 1 and 1 does not equal 2. And we look forward to the opportunity of working with everybody in this amazing endeavor. Thanks.
And Steve, it's so true, because I think that you mentioned that you'd worked with us as we supported our video and before and afters, and more the video than the before and afters, because we've worked in the past with brands where we went and we did studies with IRSI, and then we did before and after photos, in other parts of the country for home shopping networks. And then we did the video production here, and we had to do 3 separate studies. And the problem with that is it takes time and money, but the other problem is that you're not using the same group of participants, right? So now with the consumer perception here, in combination with the clinical studies, we're able to do everything all together. But more importantly, the consumers or the participants are able to see the results right in-house. And that's what makes our data more usable, more relevant, more real, because you're using one group of participants, and it really makes a big difference in the results that you're getting. With the video testimonials, we're talking to them on camera and they're sharing their experience. And we can even do like little focus groups. We have a space here in studio that we can do little focus groups, and that's nice because then you're sort of able to tell that story in more of a long form. And keep in mind that all of these services are exclusively together only with Media Lab Science. You won't find this anywhere else. The video testimonials are sort of my favorite in a way, because, I think Kelly, I think you said it to me one time. It's like, when I get behind the camera, I love talking to the women. It's as if I'm in a spa.
Yeah. Yes. And Ameann is amazing. When we do our video testimonials, what I think makes ours different is that Ameann, because she's been in the beauty industry for so long, she speaks beauty. She knows the right questions to ask. She knows how to bring out their personal experience. And our video testimonials become she used the words real and usable, and I use the words truthful and organic, because it comes from a place that is inside of them. It's a beautiful thing to watch what we're able to pull out and get on camera, and then of course support with our scientific claims. So when our testimonials are done and you are getting compelling content that is going to help sell your product, and we get the clinical testing, the video testimonials, and it's just going to catapult your brand success.
Before and after photos, I remember, and I'm sorry, Steve and Lucas and Erlandi, I remember seeing early on in the industry, seeing my first set of before and after photos going, why are their eyes closed? And why do they have, a thing on their forehead? And it's great because with those before and after photos, you're able to do a lot of analysis and you're able to see the pores of the porphyrines, you're able to see the fine lines, you're able to see pigmentation, brown spots underneath the skin. But to a consumer, those before and after photos are not as appealing. And with our before and after photos, you're not only getting the quality where the photographer is zooming in on the tiniest little pore or the littlest fine wrinkle, you're getting reproducible quality that you're duplicating from day 1 to day 30, day 60, day 90, 120, however long your study is going. Those photos are professional quality photos that you can use and zoom in on the website or any social and digital content.
Can't talk.
So, does everybody hear me okay? Yep, okay. So why us, right? Why would you want to create a study with Media Lab Science? And the difference is that we have a team of experts that can help and guide you through this process. And it's not only about the content that you receive, it's about creating the proper study. It's about creating a study that gives you different types of results that maybe other people are creating. And so we sit down with you and we really take you through that process and the results of the products, because we understand products, ingredients, technology from a technical level. Being industry experts in product development and clinical testing, we're able to sort of maybe help you rethink the way that you want to do that study. And of course, we have incredible LA production. The quality of production is phenomenal because we have access to all of the industry experts. And the recruitment is probably one of our most underrated assets, I would say. So with the social and digital content, you can take this and work with us in the beginning to create branded content. And this particular shot, you have people taking a nutraceutical. And there was a group of women who tried a product and they wanted it super clean background. But we've also done ones for hair care where we've done them in a salon. So the brand can work with us to do the set design and to make sure that you're getting the branded content that you want for your brand, which is super important. And you get to keep that content, every part of it, all the behind the scenes, the entire story. We're not cutting it for you. We're allowing you to take all of that footage with you, because I know from experience that sometimes one particular social digital little cut will do really, really well. And maybe you want to take that person and get all of their content and start blowing it out and telling that story. You may think you know based on results what consumers are going to resonate with, but when you test different types of results, you may find that this consumer resonated better with this group, and then you can go back and get all of her footage. So the LA production, Kelly, you have the most experience in casting, in acting.
Yes. So one of the things that makes Media Lab Science so special is the fact of our Los Angeles production. So one of the benefits of being in Los Angeles, it gives us added benefit not found in other areas. We are surrounded by studios and we're surrounded by the top entertainment professionals in their field. So I'm able to pull in, work with the best photographers, the best DPs, the best production designers, the list goes on and on. So when I am producing your content for you and we sit down and we meet and you tell me what you want, you tell me what the look is, you tell me what the aesthetic is, and then that's what we're going to deliver for you. I produce these videos, these testimonials, these before and afters, as if with the same dedication, professionalism as I have produced TV film. I recruit for you the same way, so that when you come to us, your brand aesthetic, what you're looking for, is unmatched with the professionalism that we can give to you with Media Lab Science, being based in Los Angeles with our production. I'm very excited about it, if you couldn't tell. Okay, so recruiting. This is what also makes us very special. being based in Los Angeles, there's a lot of people living in Los Angeles, as we all know, and it is a melting pot. I am able to bring in participants based on your distinct parameters that you're asking for, because I have a melting pot. I can bring in different ethnicity, male, female, hair care, makeup, skincare, people who speak many different languages, which I think is beautiful to be able to capture on film, because the world is, it's a blend. And so in Los Angeles, that is what you're able to get. When I recruit what I like to call real people. I use my database. I go above and beyond. I'm a very much of an out-of-the-box thinker when it comes to recruitment. There was a product that we had recently where it was a very specific profession that they were looking for. I will go out of my way to call different businesses, go visit, to listen, to try to pull in these people that we are looking for, our participants. And also being in LA, the participants usually are very comfortable on camera. For some reason, they could be a production assistant, or they could be a school teacher, a nurse, it doesn't matter. And they just all have this comfortability with them when it comes to being on camera, not just with photos, but also speaking and doing the testimonials. So when my recruiting comes into play, it's just different than probably anything you've seen before. And I'm very proud of what I do with the recruitment and excited to show that to you.
And that really does come through when I'm behind the camera. You know, I can see that they're comfortable on camera. I also wanted to mention a couple slides back, there was a group of 4 women in that particular photo. That was actually the winner's photo, or you want to kind of say the best of the best. So that was after the consumer perception studies. After the study, there were 4 or 5 women who really had incredible results. And the brand decided to do a photo shoot just to have those women featured on their website. And so that's something that we can facilitate as well. But being beauty experts, we help you manage the process from start to finish, from science, from the ingredients, the technology, and what the product is supposed to do based on the clinical studies from the ingredient supplier, to understanding how those ingredients work on the skin and then be able to draw that out, and then walking through the entire process with you, from clinical instrumentation testing, expert grading, consumer perception, before and after photos, social and digital content. So as beauty experts in every part of the field, that's how we partner with you to really make sure that you're getting the best possible testing in the most usable way.
What do we offer that makes us different? We offer clinical testing, we offer before and afters, and we've heard Ameann talk about that. I know what the pictures look like coming out of the Vizia and all of these other digital technologies. They ain't pretty, and up to now there was no way to get the type of quality images that would be helpful in the campaign. We can now do that. We can also provide, and we've heard this throughout, digital content, real people talking about the product. But number one is clinical testing. If you don't have the type of scientific support for your claims, you are asking for trouble. We live in a litigious society, and there is, as I lecture many, many times, your worst enemy is not the FDA, you're not the FTC. Your worst enemy is your competition. And if for a moment they think that what you're doing is going to impinge on their profits, they're going to come after you hard and fast. If you don't have the clinical testing, you will spend a long time suffering for this inadequacy. So that it is the focal point of everything we do. But to have it alone without everything else is really a waste of what you can get today from Media Lab Sciences. And I think it's a terrific opportunity. And Ameann, carry on from there. I'm getting off my bully pulpit.
Thank you, Steve. And honestly, I really appreciate the camaraderie that we have as a group. And I hope that comes through when we work with the brands. And I hope that comes through with each and every one of you as you ask questions. We've gotten some really good questions coming through. So just, as a recap, clinical testing, before and after photos, video content really creates the best digital content, whether that's a testimonial or on camera or before and after. We really are the complete package. And we can't wait to schedule, after this webinar, we'll be sending out a video that you guys can see a little bit of recap, sort of some behind the scenes things that we've done. We're going to be scheduling one-on-one tours of the offices here in Studio City, so you can see the clinical testing lab that's temperature controlled. You can see where we do the before and after photos and the video content. And so, we can't wait to share that with you. And we do appreciate all the questions. If there's any additional questions that you guys can type in the Microsoft chat there if you have any additional questions. But we really do try to have everything that you could think of as a brand to test for. And also keep in mind, you don't have to do everything, right? If you just want to do video, if you just want to do photo, or you want to do expert grading, it doesn't all have to be done together. This is obviously a litany of all the things that we provide, but we do appreciate your time today. And there's some, if you'd like to email us directly, those are the email addresses. But I'm just going to take a moment to answer some of the questions that came on during this time. And then if there's any additional ones, just let us know. So the first question that I wanted to address is how many people can you do during a study? So if we're doing a study, normally the best is to do at least 30, right? But in some cases, we can do smaller amounts if you'd like, but we'd like, can do at least 30. So we can do before and after photos of 30 people in one day. When we're doing video, it's better to do around 15. So we do split that up because obviously talking to 30 people in one day, it doesn't give us enough time to really get that content that we want. So if you're doing a 30 participants, where we recruit 35, it'll take 2 days to do your video production. The next question is—
Jump in for a quick second.
Yes.
The number of subjects will be determined as to that population size that will be able to support your claims. That's our starting goal. And then we work down through Ameann. And also today in the day of COVID, everything is kind of cut in half. But the number of subjects will be decided in advance, and then we whittle through them into Ameann for the production part. But you will never be left with not enough people.
Absolutely, yes. And I think that I was taking the question as like, how many can you do in one day? So the most we can do is 130 in one day. The second question is, can you do shoots during COVID and what that looks like? And since Kelly really handles our COVID and our COVID compliance, I'll let her take that one.
Yes. Hi. As of this moment, yes, we are absolutely doing shoots. I treat the set as if it was a movie set. So during COVID, I have taken different measures than I would have normally taken. So as for a fact, we had a shoot just last month, and I pared the set down, just so you know, to only who is needed. All of my crew has been COVID set trained. Everybody's gone through certification, including myself and Ameann. Limiting visitors, anything like that, that's a no. Also, I also bring on a COVID compliance officer. So I actually treat your production, our set, as if it is a movie set or a television set. And I follow, because I am still a member of all these unions, I follow those rules. And I treat, the biggest thing is the safety of everyone. And so I treat each set just as if it was a union set, to be quite honest with you. And so we are definitely shooting, and I have studied, as have all my crew, everything that we need to do to run the safest set that we possibly could during COVID. I also did individual Zoom calls with all the participants.
Oh, yeah.
To go over the new set rules, like I said, above and beyond the new set rules, what is required of everyone, including the crew and of the participants during this time.
I'm just going to take one last question, just in last of time, and all the rest of the questions that came through on the chat will respond directly to those people that had the questions, or you can email us directly if you didn't put them in the chat. But the last question is regarding the instrumentation and the advanced studies. So the question is, how do you determine some of the advanced things in combination with the consumer perception? Like, in other words, if they wanted to, I think this person maybe had done some studies at RSI in the past. So Steve, I don't know if you could answer that in a more general way.
Yeah, yes. Again, the first thing is Lucas Jr. and I, along with you, will design the proper study with the proper technology that's necessary. We will, in the LA office, we will have a Vizia so that we can use that. We will have all of the handheld moisture meters, tools, cutometers that are necessary to quantify some of the results. Should there be a need for something even more potent than this, then we will take that particular part back to either IRSI in New York, where we will have color phase, we have state-of-the-art equipment to measure technological advances, or if it's better down at Allergisa, it will go there. You will always get the best of the best when it comes to technology, and we're not going to try and shoehorn something because we don't have a piece of equipment in our LA lab, therefore it shouldn't be used. Again, we are solution people, problem solvers, so that it will always be top of the line with technology for you in your projects. I hope that answers the question.
I've been in the industry for more than 30 years. I started as an esthetician, licensed. I had my own spa, so I really understand beauty. For the past few years, I've been doing product development, but I've always known that the success of products becomes even more successful when you do clinical testing. And I'm so excited to work with Lucas and his team.
So thank you, Ameann, for the introduction. I can speak for myself. Thank you. First of all, as a partner of Media Lab Science, it's a great pleasure to be here in this moment and present to this audience such as an innovative solution as Media Lab Science provides. At my side, I'm here to aggregate the expertise in clinical testing. With the many years I've been working at Allergisa, supporting the main players of global cosmetic industry on developing projects and methods to substantiate their product claims and create illustration of the results. Along this road, I have the opportunity to coordinate the conduction of more than 6,000 clinical studies per year and coordinate a team of 200 people in the areas of safety, efficacy, and photoprotection. I also had the experience in leading the internationalization process of our group, and that expanded the vision of our team in terms of the global market and what different culture needs, also different regions in the world. In this challenge, I had the partnership of my colleague, Erlandi Jr., our business guy, to whom I pass the microphone now.
Thank you, Lucas. As I already said a bit in the beginning, I'm responsible for the business area in the Stiga Group. I have over than 20 years of experience in sales, but I've already had the opportunity of being ahead of the marketing and planning departments. 6 years ago, me and Lucas, with our team, we started a strong process of internalization of our company. And this process brought us here today because we had the opportunity to meet Ameann and Steve the last years. And we are here today for this great joy, with a great joy. I cannot leave without saying my thank you for Lucas, for our partnership and friendship that we have, but also my big thank you for our partner and great mentor, Samuel Guerra, the founder of Investiga Group. So without him, none of this would be possible. With us, now I'm gonna leave you with Steven Schwartz, a person that I had the opportunity to meet 2 years ago, and for sure changed our lives. So it's with you, Steve.
Erlandi, thank you. And the simple fact is, if it weren't for all of us, none of us would be here. This is a team effort, and it's a great opportunity to share what we have with everyone the vast audience who's listening from all over the world. In 1977, I started IRSI in California. And even then, I knew the value of combining critical clinical studies with a different approach. Over the years, I've been involved in some of the most interesting and creative claim support, but I always felt that there was something missing that could be added to what we all do. And I first became aware of it a number of years ago when I did a project for Estee Lauder on flight cream. And we literally worked with, at that time, an airline flying 727s, but it was all first class. And what we did is we had the people on the flight crews use the product, and we did the PR. And it opened my eyes to the fact that there is a way out there to combine pure hard science, which is critical, with a very fluid way of presenting the data to the media. The one thing I do want to get across, and I will mention it again later on, is we were acutely aware of the fact that when we brought Media Labs together, the cost to you could not be 1 + 1 = 2. It had to be less than that. And what we are offering you is a very cost-efficient way to maximize every aspect of the clinical studies that you are going to do. So with that, I turn it back to Ameann, and naturally, we hope everyone enjoys and learns from this webinar. Thank you.
Thank you so much, Stephen. And you know, it's so funny. I actually sold flight cream at Bloomingdale's 59th Street, and I remember telling the story about how it was tested. This is completely true. How it was tested in flight, and we honestly thought that was an amazing selling point. So, but I want Kelly to share a little bit about her experience and why she's so important to Media Lab Science, because it really brings the production quality to the rest of our sort of beauty science team.
Thank you, Ameann. Hi, everybody. My name is Kelly Hare. I am the Director of Production and Recruiting for Media Lab Science. I actually started off in the beauty industry. I was a professional makeup artist for many years, and then I moved over into the entertainment industry, where I have worked in all aspects, from production to directing and also casting. I had the wonderful opportunity to begin working with Ameann over 5 years ago, where we took my talents and combined them with hers, and I started recruiting participants for testing of beauty products, hair products, makeup. And it was just an amazing combination. And we started being able to produce really lovely and amazing content for everybody. So I'm happy to be here and combining my passion for beauty with the science and with the entertainment aspect. So thank you.
Thank you to everyone who joined us. If you have additional questions, if you'd like to schedule a personal tour, please reach out to us directly, and we'll be following up with a link to the website, which will be live today, MediaLabScience.com. You can follow us on Instagram at Media Lab on Science, or LinkedIn at Media Lab Science. And we'll also send a link to a video that's now on YouTube at Media Lab Science YouTube channel. So thank you very much, everyone.